Hi everybody, my name is Paul Dollywell. Today I'm going to be talking to you about acute low back pain. So acute low back pain, first of all, means that it's a fresh low back pain. This is something that happened recently. This isn't your kind of back pain that's been going on for years or even months or even weeks. This is something that happened recently. Either you bent down to pick something up that was too heavy, or you had a big cough or a sneeze and something seized and you got that sharp pain in your back all of a sudden. Most commonly in my clinic, we see it with the heavy lifting stuff. You did a deadlift, you're trying to set a new PR for yourself, and things didn't go so well. That kind of thing is pretty common. But what we're specifically talking about is that band of lower back pain that goes just above the pelvis, just above your bum area, and it kind of shoots across. We're not talking about the kind of pain that shoots down your leg. We're not talking about the pain that comes up the back, but at the same time, we will be making videos on those later because they also have different kind of stretches and exercises that will help them better. This one is more specifically for that low back pain that's like a band across the lower part of your lower back, and we're going to get into some ways that you can help it out. The way this typically happens though, aside from the heavy lifting, is when one part of your spine is moving a little bit different than the rest. And that's basically what core stability is supposed to help out with, where everything's supposed to be solid, staying there as a unit. And when you don't have good stability, when you're bending down to pick something up, one of your joints or bones might be moving a little bit different than one of the other ones and can cause a pinch. That sharp pinch is what you feel when you're arching back, and it gets worse. And sometimes even when you bend forwards, it's opening up that joint, it's putting pressure on that joint, so that hurts too. Of course, this isn't comfortable and this makes your life a little bit miserable. It's going to be tough to lay on your back. It's going to be tough to go for walks. It's going to be tough to do a lot of things. So we want to give you some strategies that help out at home. So let's get into it. So the first thing we want to do when we're dealing with this kind of injury is we want to stretch out the area. Because once you get this injury, you're in pain, and you're going to get a lot of spasm that comes out as a result. Because your body's going to try to protect the area. It's in pain, it's uncomfortable, and your body says, hey, this isn't right, let's protect it, let's hold it solid so it doesn't hurt anymore. But unfortunately, that spasm, that tightness, can cause pain of its own too. So the first thing we want to do is loosen up that spasm so we can get some better relief in the actual joint. So we'll start off with some pelvic tilts. For pelvic tilts, you can be laying on your back. I always like to place the hands on the hips for this exercise. It gives you a better illustration of what's supposed to happen. So what we want is you want a tilting of the hips coming upward. So think of your groin coming up towards your belly button and just tilting up and down in this area. What this is doing is it's stretching out that part of your lower back where that pinch is happening. It might be a little bit uncomfortable, but a little bit of discomfort, as long as it doesn't get worse, is okay on this one. You're in a safe position, you won't hurt yourself, but you're just loosening up all that tightness that's hanging around there. So as it starts loosening up a little bit, you can go a little bit farther. Keep in mind, I'm not lifting my hips up. We're not doing any glute bridges here yet. And you're just staying within that comfort realm. You want to do this about 12 to 15 times, enough to get that area to loosen up. Okay, so once you've done that, we're going to get into some stretches for the hips. Now, we're pretending that this is something that's going on when you're in a lot of pain, so we can't move a whole lot right now, but what we're going to try to do is hug this knee to your chest. If this is all you can do, that's fine. If you can get farther, then that's great. You can alternate to the other side. Same thing, just lightly pulling, keeping an easy stretch, just holding for about a second, and alternating sides. I like to go for about 10 on each side for this one as well. Once that's gotten a little bit easier, we're going to switch to windshield washers. Windshield washers are where you're going to take both your knees and you're going to drop them to one side and then to the other side. And you're just going to go again to your comfort level. If I'm in a lot of pain, I might not be able to go as far. If I'm feeling a little more comfortable, I can drop them down farther. You can see that's going to help open up that lower back a little bit and start getting these hips to stretch a bit better too. Really nice, easy, gentle way to start that stretch process. After you've done your 10 per side on this one, we're going to start stretching those hips. So for this one, I can have either my leg straight on the bottom, or if it's too uncomfortable, you can keep it bent. So for myself, I'm going to keep it straight. I'm going to try to pull my knee to my opposite shoulder. Again, to your comfort. If this is all you can do, then that's fine. You can pull it farther, then pull it farther. I'm going to hang out there for about a minute, and then I'm going to switch and do the other side. Keep in mind, I'm doing these a little bit faster just for the video, but in real life you would actually count a minute. And we'll call that 1 minute. So, keynote with this one, I'm pulling my knee towards my shoulder. I'm not pulling it straight up anymore. I'm pulling it over to the side. And the reason that's different is it helps stretch out the glute muscles here. So that's where you should feel it, just in the glutes. Next, you're going to cross your leg over top of your other knee. And you're going to try to pull that to your chest. If it's too hard or it's too far, you can either try to loop a towel between your thigh and pull that to your chest, or you can hang out in this position and just push your knee down. As long as you feel a little bit of a stretch in your glute, I'll show you on the other side. As long as you feel a little bit of a stretch in this glute here, you're doing it right. But if you have the flexibility and you're not in that much pain, you can pull and try to get that thigh and knee closer to your chest. And again, you want to hold it for 1 minute here. If this is too easy, you can grab in front of your shin, pull it even farther. 1 minute, and then repeat on the other side. Again, pulling to your chest. If this is too difficult, you can grab the thigh instead. And if that's too difficult, you can just push down on the knee, and that's okay too. Great. So after this, we start to want to get a little bit of strengthening into the glutes. The reason this is important, it's going to help stabilize this hip. So as soon as we take the pressure off your lower back and put it into the glutes, you're going to be able to stabilize your hips and lower back much better, and it'll take some of that pressure off for you. So for this one, we're doing glute bridges. We want the knees about shoulder width apart, the feet shoulder width apart, and you want to try to squeeze the bum muscles. You'll notice that if you're unfamiliar with this exercise, that it can be a little bit tough to just get the bum muscles to squeeze. You might feel it more in the hamstrings, you might feel it more in the lower back, but our goal is try to get about 10 repetitions, trying to squeeze through your bum cheeks so you can kind of figure out where those muscles are. It's really important for the next exercise, because if you're not contracting through your bum muscles, you're going to start getting more pressure in your lower back, more pressure in your hamstrings. It's supposed to be a little bit difficult, and that's oftentimes why these people get injuries in the first place, is because you don't have a good control of your glute muscles. So once you've got about 10 practice repetitions there, you can do more if you like. You're going to try to squeeze these muscles again and lift your hips up. If you can't go all the way up, don't go all the way up. It's perfectly okay to go just a little bit low and come right back down. The most important thing with this exercise is you're keeping these hips stable. So what I mean by that is I don't want to see any arching of the lower back. I want to see it stay flat. So you keep that flat low back as you raise your hips up. If you notice that your hips start to rotate and then lift up, that's not right. You want to try to keep it stable. You can cheat for the first few repetitions if you're new to this by holding a little bit of tension in the abdominals, then squeezing the butt and lifting up. And that'll lock you into position. But as it gets easier for you, I want this to become automatic. So I want you to think about just keeping the hips stable and not wobbling through. No arching of the lower back, no tilting through this way, no rotation side to side, just a flat low back coming up and down. And that's why my hands are here, because I can feel if I'm cheating, I can feel if I'm rotating and coming right back down. Again, you want to go for about 12 to 15 repetitions, coming all the way up, coming all the way back down. You shouldn't have any pain in your lower back. If you are, you need to try to do a little bit better job squeezing through the glutes, or just don't come up as high for now, and then work on it as you get better. You can come lower down, right? Just like that. It's perfectly fine too. Last one, once we've done those ones, is we're going to get into a hip flexor stretch. Hip flexor stretch is something that you're going to do when you're on one knee. You can hang onto a ledge or table or a chair, whatever you have nearby if you need some balance. But we're trying to get this knee about 90 degrees here, keeping that foot nice and comfortable, nice and flat, so you're going to be more balanced and more stable. From here, you're going to again try to squeeze that bum muscle, pushing it forwards. This is important because it's going to stretch the hip flexors at the front of your hips, and this will take a lot of the pressure off your lower back. This muscle actually attaches to your entire lower back here and comes all the way down your hips here. It's a big muscle, it's a strong muscle, and the more you sit, the tighter it gets. And the more you have an injury and a spasm, the tighter it gets too. So it's a big part of your recovery. So again, squeezing the bum, pushing hips forward. Notice I don't go very far. If you find that you're leaning way forwards, you're getting not much of a stretch, that means you haven't contracted the glutes. So I want you to back off the stretch, squeeze through your bum, and push your hips forwards instead. You should feel a stretch right in the front of your thigh. It might even travel down a little bit, and that's okay. It's just how the stretch feels. Hang out there for about a minute and get the other side. Again, for the hip flexor stretch, knee is bent 90 degrees, foot is flat. On the back foot, I can either be up on the toe or I can be down. It doesn't really matter. Personally, I find it more comfortable to be up on the toe and I feel more balanced. Again, have that chair handy if you need it. Squeeze your bum, push it forwards, and try to do it actively. Don't actually push your bum forwards, but try to do it through the actual muscle. Squeeze, push, and you should feel that stretch in the front. You're also going to want to try to keep your back flat here too. Some people do have a tendency of really arching their back, but again, if this area hurts, you don't want to do that. It's just going to make the pain worse, right? So pushing through the front, you should only feel stretch in the front and hold it there for about a minute. And then backing off. So those are my favorite stretches for lower back pain. Hopefully this helps you out. I do like to recommend that you do these exercises at least twice a day, if not 3 times. You can also add some heat throughout the day as you can as well. You know, if you have heated seats in the car or you have a hot pack at work, whatever you can do, 15 to 20 minutes is usually pretty good. Maximum every hour. Anything beyond that, usually you start getting some swelling at the site, which is not good for blood flow. But anything you can do to kind of help loosen up the muscles will help make a difference. Keep up the walking, keep up the stretching, and hopefully you'll get some good relief. Thanks for watching.